I'm Sybil Hipley, Government Affairs Director with the Washington State Labor Council, AFL-CIO. We support HB 1151. This bill would require that public and school employee plans, as well as large group plans, cover fertility services. Many of our affiliated unions support and prioritize this bill. Nationally, about 50% of Americans have employer-sponsored insurance. Employer health plans are a critical pathway for accessing health services such as fertility coverage. Unfortunately, fertility services are too often excluded from health plans, creating significant barriers to access. A recent Harvard Business Review article highlights a survey of workers on fertility. 88% of responding employees would consider changing jobs for access to fertility benefits. In addition, 89% of employees reported that fertility and trying to grow their family had negatively impacted their mental health. We know that Washington workers have switched jobs to get fertility benefits. They shouldn't have to leave their jobs for this care. We know the stress and pain that lack of access to fertility benefits creates for working people, and they shouldn't have to suffer. I'll note that access to fertility services is not a challenge for the wealthy. Please move forward HB 1151 to help working families have the families they want. Thank you so much.
Thank you.
Thank you, committee members. My name is Catherine Tarlock, and I'm a mother of a perfect little one-year-old girl named Alice. And I'm so lucky and thankful to be able to say that. My husband and I always knew we wanted to have a family, and we started trying as soon as we got married. I became pregnant, but unfortunately experienced a miscarriage. This miscarriage resulted in several complications that made conceiving a child very difficult to impossible. And this was devastating news. I was so relieved that medical intervention was possible. But in addition to the daunting emotional toll and daily shots, the potential cost was the most daunting aspect. My insurance covered nothing after my diagnosis, and I became a statistic. One in 8 women don't get coverage for their medical condition, and I am one of them. We scraped together money and pulled from retirement, and our families thankfully loaned us the rest. But as I said earlier, I'm lucky because we could pay for my medical care, and IVF worked for us. And last December, Alice arrived and I became a mother and my husband became a father. Please pass this bill so that this medical condition is covered and all of the people who are so desperately trying to start a family can. Thank you very much.
Thank you, Ms. Tarlock.